My name is Dingli, co-founder of Oncodea, and today we're thrilled to have Dr. David Dingli, a renowned oncologist and hematologist from Mayo Clinic, joining us. And Dr. Dingley's wealth of knowledge and passion for this work in cancer research have made a profound impact on the field, and we're excited to dive into his insight today. Welcome, Dr. Dingli.
Thank you very much, Dan, for inviting me for this conversation today.
Thank you for being here. And Dr. Dingli, you've been such an influential figure in cancer research. Could you share with us what initially inspired you to pursue a career in oncology and what continues to drive your passion in the field?
So when I was in training in medical school and subsequently during residency, two things struck me. First of all, at that time, I was working in a different country, and patients with hematologic diseases did not have a specific specialist who could take care of them. So that was a stimulus for me to get into the field of hematology. The second reason was that then, and maybe even still now, the interface between molecular biology, molecular understanding of disease, and the actual disease is nowhere closer than in hematology. I mean, the sickle cell disease was the first disease that was understood at a molecular level. I mean, if one thinks about it, this is incredible. A single mutation can result in a change in one amino acid in a protein, and it is something that affects millions of people in the world. And there are thousands of these diseases, and many of them are in hematology. So this interface between basic science and hematology always fascinated me. And then how we're going to use that knowledge to make the lives of patients better with targeted therapies, antibodies, etc.
Very inspiring to hear. And one of the topics that we explore here at Oncodea is the importance of early cancer detection. And so from your perspective, where do you see the most promising advancements in cancer screening and early detection technologies, and how these impact treatment outcomes?
Because the technologies are becoming available now that can allow rapid and hopefully non-invasive screening of patients. Let's face it, no patient likes to be probed and pushed here and there and all sorts of imaging. But if we can move the needle forward and use non-invasive technologies, then I think those will be much more accessible to patients. They can obviously be repeated more frequently because there is no risk to the patient. And I would also argue that these technologies will likely be cheaper because doing repeated imaging, repeated procedures such as colonoscopy, it certainly is very expensive.
And also, artificial intelligence is playing a growing role in many industries, including healthcare. And so what's your take on how AI can revolutionize cancer screening?
AI will likely be able to decipher patterns and identify diseases that we do not yet know about. There are patterns out there. That's what a disease is, right? It's a pattern of symptoms and laboratory studies. And I think AI can probably decipher those, the constellation of clinical and laboratory features that could suggest a diagnosis much better and much faster than humans can. And in that regard, I think there'll be a lot of promise when it comes to the AI analysis.
And how close are we to seeing AI-driven diagnostics in routine clinical practice?
So AI in pathology is going to be fundamental, both for imaging of tissue and diagnosis, but also for interpretation of serological tests that are being developed. The other thing I would say is that AI is already being trained to read the radiologic imaging data, and it can do it probably better than humans.
And many of our viewers might be students or early career professionals interested in pursuing a career in science. What advice would you give to someone looking to make an impact in the cancer research?
I think a major focus in the future is going to be this in silico work. So any budding scientist out there that is not sure where they want to be, I think my advice would be look into the possibility of data science, AI analysis of data, because the field really has the wind in its sails now.
And Dr. Dingli, thank you so much for sharing your insights with us today. Your dedication and passion for making strides in cancer research are truly inspiring, and we're honored to have the chance to hear from you. And for our viewers, we encourage you to stay tuned for more interviews like this as we continue to explore the cutting edge of cancer detection and treatment. Thank you, Dr. Dingli.